Hello, my name is Brian Clark. I'm editor with the Modesto Bee, and I'm here with Dr. Julie Vaishampayan, Public Health Officer of Stanislaus County. And Dr. V, we're here to talk about coronavirus. What's the situation right now, globally and in Stanislaus County?
Yeah, so we're seeing an increase of this coronavirus. You know, this virus was first identified back in early January, right? So there's a lot we don't know about it yet, but we certainly are seeing cases increasing. They're increasing worldwide. They're increasing in the United States, and they're increasing in California. In Stanislaus County, we don't have a confirmed case.
Okay. And that means just no cases?
No cases have been confirmed in Stanislaus County.
How would that confirmation take place?
So the confirmation would be by testing. So laboratory testing would confirm a case.
And you would know every single test or
Yes.
the information would come to you from
Yes.
the hospital or a place like that?
Yes, that gets reported to
Yeah.
us.
The virus seems to be slowing down in China. What does that mean? And is that an indicator for what will happen here over a similar amount of time?
Yeah, so China put in a lot of measures and closed a lot of interactions and what we call their social distancing or their community mitigation, and they really have seen a good decrease in their cases. Their outbreak seems to be resolving. However, cases are now being seen in other countries, and outbreaks are certainly expanding in other countries.
Okay. There's been a lot on social media, a lot of rumors flying around. There was one on Saturday that there was a coronavirus case in Modesto.
Yes.
Where and how should people get their information? And just tell me kind of what it is like for you.
Right, so it's great. We need to get our information from credible sources. The CDC has great information. California Department of Public Health also has good information. Our website has some information. We are updating it. And we have on there the number of people who have been tested, the number of negative tests, the number of pending tests. We have travelers that are being monitored. Our website is schsa.org, and so people can go there and learn about the situation in Stanislaus County.
And so these rumors flying around on social, how does that affect you? And are you getting an increased number of phone calls? And tell me about that.
Yes. So there's a lot of rumors flying around about many things, including cases. I mean, there's rumors flying about origin of the virus and many other things. But so yes, we do get a lot of phone calls, and we spend a lot of time trying to squash these rumors because they're just not true. If we did have a case in this county, we would absolutely be telling people. If we feel, right now, we feel that the risk for people in Stanislaus County is in general low for the general population because we have not yet identified cases here. So if that risk changes, we will absolutely be telling people, yes. So we'll tell you if there's a case, we'll tell you if we think the risk changes.
And you're the final authority?
So all of it comes through me, so yes, I will know.
So every hospital, clinic, if they find
Reports.
something out, they report to you.
They
and then you
do.
report that. And how quick is that turnaround time?
So when, right now, because the testing is still only available through public health labs, they come to us to get the testing done. So we know what's going on, we know who's getting testing done, we coordinate getting the test samples, which are swabs from the nose and the mouth. And so we get them up to the California Department of Public Health lab where they will do the testing and get results back. Once the specimens are on their way, it takes about 48 hours, to say about a day to overnight them and get them up there in a day to test.
Okay. And is there a way to, can the spread to Stanislaus County, is there any way that can be prevented?
Well, that's going to be pretty hard because people move around. People move around for jobs. People move around, well, for jobs and for school, and we mix with other populations. You know, we don't just stay in our county or stay in our home. So I think the chances are, nobody has a crystal ball, and certainly not me, but I think the chances are we will see cases here. We will see spread here, and we need to start being prepared for that, yes.
And so how does the community prepare for something like that?
So there's many different ways. So first of all, get the flu shot. That's one way because let's keep it to one respiratory virus at a time, right? This is a respiratory virus. So coughing and fever, it's passed from person to person by coughing and sneezing, same as flu, so kind of think about flu. So other ways to protect you are the ways we talk about with flu. We don't have a vaccine, so sadly, but you can still get your flu vaccine to protect against flu. We don't have treatment right now, so what we have is that washing your hands. Washing your hands really works. with soap and running water preferably. You can use hand sanitizer. Keep your hands away from your eyes, nose, or mouth, your face. You hear that all the time, but if you have virus on your hand, because maybe someone coughed into their hand and then they shook your hand, so if you have virus on your hand, it doesn't infect you from your skin. You have to introduce it up here, into your face area. So if you wash frequently and keep your hands away from your face, you really protect yourself. If you're sick, you need to stay home. If your kids are sick, keep them home, and that way you can avoid spread.
Right. And what about social distance?
Yeah, so that social distance thing, so people go like, what is this? So social distance is the distance we're comfortable in the United States talking to people, right? I mean, when people get too close, they're in your space, and so that distance is about 3 to 6 feet. So the further away you can get, the less likely you are you're going to get coughed on or sneezed on or transmit the virus more. So we try to keep that social distance from people.
When you talk about flu, there's the flu and there's the coronavirus, and people are saying, well, X amount of people die from the flu. Kind of talk a little bit about that if you can. The differences, the mortality rate, where coronavirus ranks right now when you talk about MERS and SARS and other.
Yeah, so, wow, there's a lot of questions in there. The coronavirus, so it's new, right? And we don't know that much about it. We're getting close to maybe 2 months of knowing about this, but there's so much we don't know. So right now, the mortality rate, or the people that are dying after getting infected, looks pretty high. But we know there's a lot of mild disease out there that isn't being detected. So as we start detecting more disease, we think that fatality rate will come down and it won't look quite as severe. Will it come down to be like a seasonal flu? It could. I don't know. Again, I have no crystal ball and knowledge of the future and what we're going to find out. But the concern, even if it does, is that we don't have immunity. So there aren't people in a community that are immune. So when everybody's susceptible, even if we can get that mortality rate down, it's still going to be more severe than flu.
Yeah. So if you could put that mortality rate, which is what, about 2%, 1.5% to 2%?
Somewhere in there is the estimate right now, yeah.
And what's the mortality rate of the flu?
So flu right now, they're saying about 0.1%.
Okay.
So even if we could get down to that level, we'll still probably, in my not crystal ball, probably see more spread and more people ill, and so it would be a very bad flu season if it spreads like flu.
And it spreads easier than the flu?
We're thinking
a person
maybe,
can infect, in the flu I think it's 1.3%.
Yeah.
And coronavirus is 2.2.
It's looking a little bit higher. It's still just really hard to say because we're trying to get information from China where they really have had a lot of spread. And they were pretty overwhelmed with taking care of the patients to come up with good, accurate studies to show this. So what we see now looks like it's going to spread more than flu. We don't know what it looks like. It might be more severe than flu, but we're still not sure.
Right. Do masks help? I've seen some people with masks, so talk about those.
Oh, I love to talk about masks. So masks are good. There's a couple different kind of masks and a couple of different uses. So what we see for the public wearing mostly are surgical masks, and those work, as we call it, for source control. So if you are ill, you should stay home. If you have to go out for some reason or another, putting a mask on keeps the infection in you and prevents you spreading it to other people. If you are a well person, wearing a mask really isn't at all helpful, and we do not recommend that.
Mm-hmm.
Yeah.
Okay. What are the symptoms that people get where to the point where maybe I should go get tested, or maybe where a nurse practitioner or doctor would say it's time for a test?
Right. So right now, because testing is still limited in public health labs, FDA did put out some new, they're really trying to get testing out and be more widely available.
Mm-hmm.
So right now, testing is still, there's some travel linkages to countries where there is a lot of transmission, so like Italy and Iran, South Korea, Japan, China, they are having relatively widespread transmission, and so travel from those countries and becoming ill with a fever and a cough would get you a test. So Other than that, most of the testing is going to people who are hospitalized and develop pneumonia. And testing for like flu and other viruses and bacteria are negative.
Right.
So for the general person, if they're mildly ill, stay home. I mean, it's the same guidance, stay home.
Right.
Yeah, and do all those things to stop transmitting the infection to other people.
Who's most at risk? Who's least at risk?
Yeah, so for severe disease, so at risk of infection is probably everybody. So at risk of having severe disease and not doing well with disease appears to be people older, somewhat undefined. You can use 65, you can use 60, I don't know. People with underlying heart disease, people with underlying lung disease, other underlying conditions such as diabetes, pretty sure about those. There's still information to be known about other risk factors. Pregnant women comes up a lot. That's not known yet if they're at any increased risk. Children seem to be protected from severe disease, so that's great news. Yeah.
Okay, and even young small babies.
And even young small babies, we haven't seen a lot. I mean, there have been some hospitalized, but in general, they seem to be protected from severe disease. Yes.
We got some questions from some readers. How is coronavirus transferred from the infected to the non-infected? You know, we're talking droplets from coughs or sneezes, fecal, oral. How is that?
So again, I sound like a broken record, but a lot of it's not known yet.
Yeah.
Certainly coughs and sneezes, absolutely. How much is oral fecal involved is not clear yet. How much is surfaces, like, you know, touching doorknobs and having it in your hand, it's not clear yet. Clearly coughs and sneezes, I don't know that anything else has a good, some good data behind it yet.
Okay, and one of the couple last remaining questions. Are we sure that this virus is not transferred by more than one route?
So back to the question, no, but it seems the majority is going to be coughs and sneezes, and the regular respiratory virus transmission is truly the most important, and that is for most other viruses as well, those respiratory viruses. So, I mean, really thinking about that, washing your hands, however, protects against all different routes of exposure, right? Just if you know, the oral fecal often has a hand component to it too, so that frequent hand washing is really a great thing to do.
Okay, and how long does the virus remain viable outside on host surfaces?
Yeah, so I don't think they know that yet. One of the things that's true of all viruses is that they live, it depends on time, temperature, and humidity, warmth. So like a hot car in the middle of summer, it's not gonna live on there, like, I mean, minutes, right? And yet if it's freezing, it's very cold, car and not in the sun, it can probably live for an hour or two. Not known yet, but the colder it is, the longer it can live on a surface. That's known. How long, I don't have a number.
And no way to know if this is something, you know, seasonal, if it's winter, spring, summer.
We certainly hope it is, but no, because this is the first time we've ever seen it. We have no idea how it will act.
Again, if the virus remains viable for a long time, is wiping surfaces with anti-infective wipes appropriate?
Yeah, so there are, if we use an EPA approved antiviral wipe, any wipe is better than no wipe, using anything, but there are antiviral ones by the EPA that absolutely will work. And increasing the frequency of cleaning surfaces that are frequently touched, like doorknobs and things like that, will help stop transmission if there's a large component of that surface transmission. Yeah.
And using gloves.
Yeah, I mean, not for the general population, but for others, it's certainly in healthcare, we would recommend that.
Yeah. Last two questions. Is there any guidance going out to churches regarding interaction and
Yes. Yeah, so we are putting out some guidance to churches, especially, you know, churches do have the handshake a lot, and there is closer interaction. So we are putting out some guidance to churches, the faith-based community, as well as businesses and schools, about being prepared and how to decrease that. Frequent hand hygiene, hand sanitizer out in places, ensuring that there's running water and soap always stocked, and just trying to take those everyday actions that people can take to keep themselves healthy.
Yeah. And again, when you say you've been getting a lot more calls, should they call your office, or who should they call if they're really concerned?
So people are concerned, can call the office, there's a number on the website. I would recommend going to CDC, there is so much information there for people. I think it could answer most of your questions, but there's always questions we haven't thought of, and we are here to answer questions.
Great, so far all clear in Stanislaus
So
County?
far, all clear.
Okay,
Yeah.
well, Dr. V, I appreciate your time. Thank you for joining us. You can watch the video at modby.com or on YouTube, and you can also see our story later today at modby.com. Thanks for joining us. I'm Brian Clark, editor of the Modesto Bee.